who've had the opportunity to join us at previous sessions earlier in the week. Welcome back. And with that being said, it's my pleasure to introduce to you today Sassy Outwater-Wright, the Executive Director from the Massachusetts Association for the Blind and Visually Impaired. Sassy, the floor is yours.
Thanks, Colleen. Thank you, everybody, for being here. There are many places that you could be, and I'm so happy that you chose to spend it here during your probably lunch break. So sit down, grab some food, grab a good beverage, and we'll chat about some topics that tend to be really tough. Thank you, Colleen, so much for pulling together a week like this. The majority of calls that I get, both as the executive director of MABVI and in my previous roles, in blindness as a tech instructor for access technology and as a clinician in chaplaincy, actually, are relating to supporting someone through a disability when you don't have a lot of information about how that person copes with the disability. And fear takes over. We tend to come at this from a fear-based discomfort response. We tend to not like this topic. It's scary, it's uncomfortable. Especially for older adults, especially when someone has had the majority of their life with eyesight and being able to drive and read and do things that we consider essentials in our society. And I'm air quoting that. We tend to come at the loss of eyesight from a fear-based response, especially when we're family members who are either distant and away or not in the household with the person who's losing their eyesight, or if we are seeing them push people away and not want help or not get the help that we think that they should be getting. And we don't even know what help we think they should be getting, but we tend to say, go to the doctor can fix it, the doctor knows what to do, or go to this center, learn to read Braille. We tend to just kind of jump to the things that we, on the surface, know about blindness and loss of eyesight. We tend to either go corrective or totally blind. And so we tend to get very kind of stuck in our Hollywood viewpoint of what blindness might be like, or what loss of eyesight, low vision might be like. And I'm going to kind of pause there and define two terms. One is low vision or visually impaired. We hear both a lot these days. And both are fine. Both actually encompass what we're doing. You might hear the term legal blindness as well. Legal blindness doesn't mean complete loss of eyesight. It means something from 2200 on, which means that the person can see. I'm trying to put this in layman's terms and not get into what they see at a certain foot range is what they see at a certain foot range. The short and sweet answer is that their vision is not something that you could drive with. It's not correctable. There is a severe loss of eyesight. That's the layman's way of phrasing this. So I don't pull everybody into the weeds. I don't like to pull people into the weeds of that. I'll let Dr. Malkin do that tomorrow in terms of the actual visual impairment piece. But I will get into the fact that legal blindness, visually impaired, and low vision are all interchangeable. Rarely for older adults will you see somebody who is totally blind and cannot see at all. It can happen. There are a couple of eye conditions that can cause that, but it's very, very rare. The majority of those of us who are blind, I am blind myself, and the majority of those of us who are completely blind happen at birth or during childhood, unless there's a traumatic accident or something that happens during adulthood, or an eye condition progresses during adulthood over a number of years and vision degenerates, and then total blindness becomes a factor. But usually that takes a number of years to happen. So generally for older adults, we will see low vision or visual impairment. And it will set in more gradually. It's fairly rare that it happens at a very quick onset, but it can happen. But when it does happen, a lot of the calls that I get are from family members who are really upset because their family member, usually a parent, or even a grandparent, has vision loss, and they don't know how to cope with it. And I'm air quoting the word they being the family member. And I want to highlight that this is what MABVI does. This is pretty much 90% of what we do, is supporting not just the person going through the loss of the eyesight, but helping people around them cope with the onset of loss of eyesight as well. Because if the family members are not able to know how to support, then things can happen that set the person back. And that's what I want to highlight today, is how can we help support the person who is receiving support to adjust to their loss of eyesight? How can we step in and play a positive role in that? How can we remove that fear-based response? And I want to acknowledge that it is terrifying. Blindness and loss of eyesight in our society is terrifying. It's a cause for grief. It's a cause for anger. It's all of those things. Any medical diagnosis is. That's a perfectly valid and needed response in many ways. But once we've gone through that emotional adjustment process and looked at that piece, what do we do to actually step in and deal with the physical adjustment piece? And so MABVI does both. We help with the emotional side and we help with the physical side, because if you don't have one, you don't have the other. And for the generation that is aging right now into vision loss, emotional adjustment is the tougher piece. That generation really, by and large, loves to be strong and be stoic and not make it an emotional process. Just deal is kind of the overwhelming sense that we get when we work with them. And we have to know how to provide emotional support around, quote unquote, just deal. We do that in kind of a sneaky way. We do that with what we call peer support specialists. Someone who has been through that adjustment process, someone who has lost their eyesight too, someone who has gone through it. Most of our peer support specialists at MABVI are social workers, clinical professionals themselves who are blind or who have low vision, who have been through that process. And so they're coming at it from two angles. They're coming at it from that clinical therapy side, but they're also coming at it from I had to learn how to watch the baseball game too when I couldn't see what was going on the television screen. Here's what I've learned helps me feel like I'm still experiencing the same thing that I used to experience. Or I had to learn how to use a screen reader to read the newspaper. Here's how that works. I had to learn to cook. I had to learn to clean. I had to go through all of this process myself. And so all of our peer support specialists are available. There is no charge. They are there specifically to help with vision loss adjustment. That is all they do. That is what they do. We run 37 support groups throughout the state of Massachusetts. And at each support group, there is somebody from our adjustment counseling team, whether it's one of our licensed social workers who provides one-to-one, what we think of as traditional therapy, or whether it's one of our peer support specialists who provides that support service of commiseration and understanding. And then they're done that. We have somebody from our clinical team present at every meeting of our support groups. Currently, because of COVID, our support groups are meeting by phone. And so anybody can join, and you can reach out to us to find out about a support group in your area. So you can get group support. You can hear about things going on in the blindness and low vision community that might help. You can make friends with people who are going through what you're going through as a person who is aging into vision loss. These are mostly for older adults. And or as somebody who is caring for someone who is going through loss of eyesight, you can help that person find some community, find some social support. We tend to see a lot of social isolation happen, A, when you're an older adult, but B, when you are losing your eyesight. And so the support groups are a good first step to dip your toe in the water of finding people who are going through a similar experience. The person does not have to be in a support group to get that peer support or to get clinical counseling for adjustment to being a blind person. But it is a huge community help and support. And we do recommend that if the person feels comfortable in a group setting, that is the best way to start getting into our community and finding out that it is okay to receive support. A lot of people are resistant, going back to that just deal, they're resistant to receiving support because it means that they have to accept that they're going through loss of their eyesight. And that's really hard for a lot of people. And we hold space for that. We just let that be hard because there's no easy way around that. We just let that exist as a hard thing, and we're here to support you through it. My operating statement for MABVI is there's no one right way to do loss of your eyesight. There's just not. What works for me is not going to work for somebody else. So each of us has to find our own way to cope with this. And my organization, the Massachusetts Association for the Blind and Visually Impaired, was founded in 1903. And our whole mission for the past 115 years is to help with that, is to support you through that. So you can discover what works for you to deal with your vision loss, and you being the blind person or the family going through it. How can we help bring the two together and support the whole of that person, family included, through that process? And it will be different for each person. So the support groups are the first thing. We have the support counseling, whether it's one-to-one with a licensed therapist or whether it's through the peer support program. Beyond that, we have volunteers. We have volunteers that you can be matched with as a blind person. The volunteer can come and help you do things such as grocery shopping, such as reading the mail and responding to the mail, because that one can be really, really hard. Somebody who used to write letters, write checks, sign Christmas cards, suddenly they can't do any of that. And that can be a very alienating experience. That can contribute to that social isolation. That can contribute to a lot of things, including financial problems. So one of the biggest things that we help support caregivers through is understanding how a person can interact with print material. That can include learning to use low vision devices such as magnifiers to read the mail independently, or having a volunteer help with it. It can be using a template to find the lines of a check rather than looking at the paper by yourself. It can be anything from using a different pen or a different lighting combination to just having the volunteer assist with that, or teaching the family members how to assist with tasks like that without violating privacy, without making the person feel like they're being taken care of. And that's a fine balance to walk, is how do you help that person feel independent and thrive and exercise autonomy while at the same time stepping into help with tasks that the person used to do by themselves. And a lot of times we see a lot of struggle between family members and the blind person about where to step in and where not to step in. So we can coach through that. Our social workers, our occupational therapists, even our volunteers can help coach through that. And this is why the volunteer program is so powerful, because if the family member doesn't want to get into that dynamic, or the blind person doesn't want to get into that dynamic of push and pull and who's going to do what task that is an activity of daily living, the volunteer can help. And it takes a lot of pressure off of the family to know that there's a volunteer there to help with things that isn't connected to the family, isn't going to start taking over, quote unquote, but is going to step in and help at the directive of the blind person themselves. So the volunteer isn't going to take over and do everything. The volunteer is going to do what the blind person asks them to assist with. And the blind person remains in control of their autonomy and able to direct their independence in a way that they like. And the term independence is one I want to stop and highlight for just a second. We often say the term independent as this goal that blind people need to live up to, or that we think they should have. That changes when you lose your eyesight. What we think of as independence as a sighted person is not the same thing as dependence as a blind person. Independence as a blind person. Because the things that we say are quote unquote independent, like reading, driving, aren't things that a blind person can do. But I'm going to push back on that. And I'm going to use the term interdependence. Even sighted people are interdependent. No one is quote unquote independent. And so this idea that a blind person has to live up to this definition of independence is one that we can't hold up. We have to all accept that we are interdependent. If you go to the grocery store and you pick up a piece of a cob of corn, that corn didn't get up out of the field, walk itself to the grocery store and park itself on the shelf for you. People put it there. It got driven there. It got harvested. There were many people who contributed to, there were many people that contributed to that corn getting to where you could pick it up off the shelf and take it home and grill it. Oh my gosh, now I want corn. I've just backed myself into a corner. I'm thinking of corn and lobster. Okay, I'm done. But we're all interdependent. We all need assistance. We all rely on assistance from other people to accomplish activities of daily living. Blindness, and here's the revelation that I will share with you as a blind person, blindness doesn't change that. Blindness does not change that. It redefines it, it reorganizes it, but it doesn't change it. Just because I cannot drive, just because I use a guide dog, just because I read Braille instead of print, just because I need to use a phone to read my print mail, that does not mean that I am dependent. It does not mean that I am independent. It means that, like every other person on this planet, I am interdependent. We got that really highlighted to us as a human species during COVID. We all had to be interdependent on each other. And hopefully that is a lesson that we can carry forward. When we receive a medical diagnosis, like loss of eyesight, we need to carry that knowledge forward. That didn't change the fact that we're interdependent. We don't need to live up to some giant expectation of independence in order to feel secure and safe. We need to redefine our levels of interdependence and know what feels good to us as blind people. And we need to help our caregivers feel that we are safe, feel that we know how to take care of ourselves and have support to do so, the right support to do so. Many times I am kind of in between family members and blind people who their family members want them to go into skilled nursing or a nursing home. And the blind person does not feel like they're ready to do that. The blind person still feels like they want to be at home, in their own home. And the family is very scared that if they stay in that home, they might set the house on fire because the stove was lit and the person didn't see it. Or an appliance malfunctions that the person couldn't read the labels on, or the person couldn't, regulate something. Last week when I was in one of these discussions, it was the temperature of hot water. And I had to calmly and gently say, okay, if the person can touch the water to find out if it's hot or not. I know that sounds like a basic, but this is what comes up because we lose sight of the basics when we're in a crisis situation. We let fear take over. And that's that fear-based response that I was talking about at the beginning of this. We let the fear dictate how we think blindness is going to affect our loved one because we love them. We are afraid for them. We are scared. So our volunteers come in to help so that people are not feeling so scared. They can help with, like I said, groceries, mail, labeling appliances, just any activity of daily living that the person needs help and support doing. The volunteers can come in and help with that. Right now, there's a waiting list to get a volunteer because so many people need them during COVID, but we do have them and they can help. The next program that we have is our Access Technology program. We used to call this the Assistive Technology program, and I'll tell you, we changed it to Access for a particular reason. That definition of interdependence that I used. The person who is blind does not need assistance to accomplish reading the mail or the newspaper. They need access to read the mail or the newspaper. They weren't the ones who decided that that thing would be in print. They weren't the ones who decided that the world would be highly visual. So they don't need assistance to live in a highly visual world. They need access to it. So it was a more empowering term. It was a more appropriate term. And it's one that we as a society need to consider. We are a highly visual society. And this is what perpetuates our fear of blindness in large part, is that we are a highly visual society. We use our eyes because they're the easiest, quickest thing to grab. Vision is the easiest, quickest thing to grab. A sighted person just flips the light switch and boom, you got vision and you can have access to something. Blind people need a couple extra steps in there, but I don't need the light to read. Sorry, I win. But we tend to fear loss of eyesight because we're such a highly visual world. And so we need to think less in terms of assistance and more in terms of how can a blind person access something. So our Access Technology program is also free. Thus far, all of the services are grant funded or funded by support of MCB and other community-based supports and state supports and federal supports, so that they are free to our older adults who need them. And the support of our tech program is that we train people to use access technologies, such as screen readers, where a voice reads information aloud from your phone or from your computer. You can't drive using this yet. Autonomous vehicles are coming though, but you can do pretty much everything else using access technology. Whether that be reading the mail, I just pick up my phone, aim my phone's camera at my mail, and boom, I'm reading my insurance bills, or I'm reading my thank you cards, or I'm reading my baby shower invites, or whatever happens to show up in the mail, I'm reading it. I can walk into any bookstore, pick up any book, and start reading. I don't need Braille particularly. I carry a Braille display in my purse, so I can pull that out and read. I have a magnifier. If I was low vision, I have a magnifier on my phone. I can enlarge text and read it, and I don't need a screen reader to read it aloud. I can just enlarge it and read it myself. If I am low vision, I can enlarge the screen so I can see it. And I have a screen reader there if I can't. So we use a combination of tools and technologies. We teach Mac, Windows, Android, and Apple devices, and others such as Kindle in the program. And we do both group trainings on particular products and services and apps. And we do one-to-one trainings. We match you with a trainer and you stay with the same trainer as you go through your training. We assess the person at the beginning when they come in for services as to what technology will be best for them and how they're going to use it and what their goals are with it. Then we take them through an entire training process on that technology. And generally along the way, the person finds more things in tech that they want to learn and they stay. It's not a determined course in terms of, okay, you get 2 weeks. It's however long the person wants to stay, we're happy to have them. However long that person needs to learn the material, they take that time. I'm not going to push someone out in 3 months. I'm not going to push someone out in 6 months. We have a lot of 85-year-olds who are very quickly using iPads. And maybe it took them a year to learn how to do it, but now they're flying. We take that time. We let them take the time that their brains need to learn the material and to feel comfortable with it. And then they go off on their own and they usually come back and they say, well, here's another app I want to learn. And that's fine. That's why the programs are paid for using grant funding. That's why the programs are free. So you can take as many lessons and as much time as you need to get comfortable with it. And we do meet with family members. We meet with caregivers. We tell you about what we have available. We walk you through what the blind person is learning. We have you, if the person is comfortable with it, you can sit in on lessons. You can see what they're working on. You can participate with them. You can learn it too. We're absolutely okay with that support. And we're happy when you are involved in their tech, in their learning, in their understanding of their blindness, because you can help support them. And that's where my next program comes in. We have an occupational therapy program. This one is paid for. It's paid for by their health insurance, Medicare or other insurance. We have an occupational therapist who's trained both in low vision and in brain injury and other age-related disabilities such as dementia. We have our occupational therapists who can come in home. This is all done in home. For the occupational therapy program, the tech training program is either done in community at senior centers close to the person or over the phone virtually, depending on where the person lives and what they want. The occupational therapy program is done in home. And we have occupational therapists who can come in home and label appliances so people can clearly see them. They can help the person learn how to do things like cooking, cleaning, understanding how to work in their home with lighting when they are low vision, helping procure devices to make sure that the person can read with magnification, helping the person adjust to living as a person who has low vision or blindness. And our occupational therapists are a good tool. You'll probably hear more about this from Dr. Malkin tomorrow. They are the good onset tool, I call them. There are also in the community through MCB's hard work, vision rehabilitation therapists. They play a completely different role. They come in and support the person as well, but they can support more quote unquote non-visual techniques, such as tactile understanding, such as, down the line, the person might want to learn Braille, such as moving and the basics to orientation and mobility, travel with a cane, things like that. The occupational therapist can come in usually 4 to 6 times we see, potentially up to 12. And the occupational therapist can come in and help the person adjust as that vision loss is first happening, helping set up the home for safety, fall risk checks, making sure that medications are safe, making sure that the person medically feels stable and safe and can adjust to living in their home as a blind person successfully. So we come in and help with everything from labeling a stove to making sure that the person's light is adjusted near the couch so they can read, to helping the person learn how to use their iPad to read ingredients on a recipe card, anything like that that helps the home feel safer and more accessible. We come in and assist with through the occupational program, and that is paid by health insurance. Those are our biggest programs, and those are the supports that we play as an older person is aging into their loss of eyesight. But along the way, you contact our staff. The majority of our staff are blind or low vision themselves or have been in this field for a very long time. And so a lot of what we do just winds up being daily support. It winds up just being talking you down when you're worried or scared, or helping you strategize a solution to a problem, or helping you figure out what the tool of access is going to be. And we spend a lot of time talking to caregivers about how to help. And I'm going to spend the last portion of my call on that and then open it up to questions and kind of talk with you guys a little bit more. I want to leave at least 20 minutes for questions and discussion. I don't want to really kind of make this a one-person lecture. This is about you and what you're experiencing in your life. There's a reason that you're on this call right now, and I want to hear from you what's on your mind, what's been bugging you, where you're not feeling supported, and where we can move to support you. And so as I talk a little bit about what you're going to do to support a blind person, I want to kind of ask you in the chat to take a minute, take 1 minute and really think, what is the one place where you have need of support in blindness rehabilitation and feeling like you are supported as a caregiver of somebody who is blind? What is the one area that you feel you need support in? And just put that in the chat and we'll kind of go over that in a couple of minutes. And I bet some of these answers are going to surprise you. I hear a lot of different ones, but I'm going to ask you from right now to take 1 minute and then write in the chat what that one area is that you feel like you need support in. I could get into all the practical things you could do, but if you shut your eyes for a minute and reach out and touch your desk or touch your coffee table or wherever you happen to be sitting, just reach in front of you and touch. And I bet what you're going to find is that where objects are on that table surprises you, or where objects are on that desk surprises you a little bit. Can you find your coffee cup if you put that down? Can you find your plate? Can you find your remote control? Whatever is sitting in front of you, can you quickly put your hand down and locate it? Oftentimes we see caregivers come into the home of somebody who is blind or who has low vision and try to help by setting things up in a way that they think the blind person can easily identify and find things, trying to make it easier for them, trying to make things more accessible for them based on what you feel as a sighted person might make sense to them as a blind person. But do you see the incongruity there? That's where we often tell people, hang on, step back. When you are a blind person, your whole spatial perspective shifts just that little bit. And so the two big things that I tell every caregiver are take your time and ask. Take your time and ask. The first one, take your time. If you see the blind person feeling around on the desk for something, it's okay to ask, do you want me to help you locate that? But don't reach out and hand them the glass of water. Don't reach out and assume that you know what they're reaching for. Don't presume. Don't step forward because it's faster for you to do the thing. Just wait it out. Give us time. If you see a hand reaching out for a stair railing, ask, but you do not have to step forward, take the hand and put it on the railing. Just wait. Ask and wait. Ask and wait. Don't presume that your mentality of a blind person's environment is what they are experiencing. Ask for their mentality, for their perspective, for their awareness, and for their directive. That is the biggest one I want to leave you with. Ask for their directive. Ask for them to inform you about what they're experiencing in their life at that moment. And ask how you can support them in that experience. Don't presume that your experience is their experience. Just ask what theirs is and then step into support where they direct you to support. That is the hardest thing because we want to do for. Love wants us to do for. Fear wants us to do for. But that interdependence thing that I highlighted a few minutes ago, love wants us and fear wants us to do for, but interdependence says that we wait. Interdependence says we do our part. Our part is directed by the blind person. So what our part is defined by that person. So when you come in to a blind person's house, ask them, do you want me to pick up that towel that's on the kitchen floor that maybe fell? If the blind person says yes, go ahead and grab it. Where would you like me to put this? Ask at each step. Don't just ask once, ask at each step. Yes, it can get annoying, but it teaches you that space that they need to experience their new world as a blind person and to find out what's possible in that world. We thrive. We are powerful. We are capable. Blindness is not a barrier to any of those things. Our perception of blindness is a barrier to those things. Our perception of blindness is my barrier to my capability, not my blindness. My blindness doesn't prevent me from doing anything, okay, except driving. But my blindness is not the barrier. People's perception of my blindness and my perception of my blindness can be a barrier. But if we pause and we take that time and we ask, the barrier goes down. The barrier slowly diminishes. We find our willingness to accept support increases, and we deal with the blindness. And we continue to do the things we want to do. We thrive. We succeed. We live the lives that we want to live. We define our limits and we define our barriers rather than someone's fear or perception or our own frustration defining our limits. The blindness is not the limit. Our perception of it is. So at that point, I want to have you put into the chat where you feel like you need support. And just write it in there and hit enter. Nobody needs to see anybody else's answers. Don't wait for someone else to start it. Just write your answer, put it in the chat and hit enter. And then I'm going to slowly turn it over and see if we have questions. If not, I have some more stuff we can discuss, but let's see what questions we have first.
This is Samantha from MCB. If somebody doesn't want to share it with the group, you can share it with me, Samantha from MCB, Carla, Kath, Kate's there too. You can share it with her, or we have some people on the phone. Feel free to unmute yourself. I know that there's not a way to do it in the chat. So feel free to unmute yourself if you don't
Yep.
mind being on the phone as well.
This is the scary kind of cliff edge moment where we're asking for vulnerability. Vulnerability is scary. Vulnerability means stating something, but here's where we have the chance to pull in the support that we need. So just throw it out there. And I know it is scary. Samantha's right. You can reach out to anybody privately, but even if it's not your specific situation, where do you feel like support is lacking, and what can we do to support the community?
Hi, Sassy. This is Kate. I have a question here from someone wondering about how they can connect with other caregivers of the blind population.
Yep, that's a really good question. So there are a lot of ways to do that. There are a lot of organizations out there, such as the National Federation of the Blind or the American Council of the Blind in Massachusetts, that's known as the Bay State Council of the Blind. There are a lot of blind people there, but around that, there are also a lot of peripheral, there are caregivers. There are a lot of ways through the Mass Commission for the Blind to hear from case managers. Oftentimes, if you are a caregiver and you are with your blind, the person who is in your family who is blind, caregivers are tangentially related. Case managers need to have the permission of the blind person to talk to the caregiver, but oftentimes if you're in the room, you can talk to the case manager, and the case manager might know of other blind people who are willing to have you talk to their family members. Oftentimes friendship just works. Meeting other blind people just works because you can talk to our families. Support groups, there used to be a lot of support group kind of activity, or people were trying for that. It didn't really go over hugely well. This was before I took over as executive director. I would like to kind of continue to push forward with creating space for that. But a lot of blind people wanted to be involved in those discussions. There is an adage in the disability community, nothing about us without us. And a lot of older blind adults really wanted to participate in those caregiver conversations and say, don't talk about me without me. Just, talk with me. Talk so that the blind person is in the room when other family members are talking. Talk so that we're included in that discussion. And so that's why the support groups kind of weren't, one of the reasons why the support groups didn't go over very well, was that the blind people wanted to be involved and wanted to feel like they had a hand in what happened to them. And so now what we suggest is make friends with blind people, make friends with us, get to know us, and we will introduce you to our family members. Then you can talk, then you can find support, then you can hear how things have worked. Ask your blind person to introduce you to your MCB case manager, and they might be able to connect you with another blind person who's been through that adjustment process. Or reach out to MABVI, and one of our peer support specialists can sit and talk with you. And they're pretty open. They'll say, yeah, you can talk to my wife. You can totally find out from her, how I deal with my blindness. They're pretty friendly. They're pretty open to having these connections and finding those discussions, but it usually starts with the blind person, surprisingly. That's how you get to the family members and the other caregivers in the community.
Thanks so much, Sassy. It looks like we have one more question here regarding your programming and COVID.
Yes.
Yes, it's just asking about
How are we doing our program?
All of the programs are open, and then it specifies as well programs with volunteers.
Awesome. Okay, so during COVID, most of our programs shifted to virtual support. First thing we did when COVID hit was we called everybody who has ever registered with our system recently, and we checked in on them and we said, how are you doing? What do you need? Is it food access that you need? Is it access to your medications and pharmaceutical support? Is it healthcare support, transportation, medical. What do you need to get through COVID safely? Then after, that was about a year ago, after all of that, then we shifted to just virtual support. So telephone supports, Zoom meetings, class trainings online, one-to-one trainings online. And then as COVID moved through, we were able to start sending our occupational therapists back out to work in home. They're in full PPE, which is protective medical equipment. Our staff who is out in home is vaccinated. And we do COVID screenings the night before we go into the home to make sure that we're not transmitting anything to the blind person and they're not transmitting anything to our staff. Temperatures are checked. Everything is super safe and disinfected. Everything is checked and rechecked. So we do have in-person and in-home services going on there. We are preparing to reopen our tech training for in-person training at a couple of our tech sites. Right now, we're looking at Brookline, and that will be expanding as more senior centers open for essential services. We are supporting the community with vaccinations for blind and low vision individuals, helping with volunteers at vaccination sites, helping get people to and from vaccination sites by working with towns and cities to arrange transportation when possible. Advocating with the state and with the health departments and cities and towns to make sure they know how to support blind or low vision people who may show up for their vaccines. In regards to the volunteer program, we did have to shut that down at the beginning of the pandemic. During the middle of the pandemic, we opened it up and we said, please remain socially distanced from each other, meet outside if possible. But if you need to have your volunteer present with you, do it, just do it socially safe, socially distanced, sorry, and do it safely and disinfect, mask, do the things that are safety precautions advised by the CDC and Department of Public Health. As things progressed and as more people became vaccinated, we said, continue to practice those socially distancing guidelines, be safe, be masked, and we will continue to kind of follow the governor's and the CDC's recommendations for where those limits are and what people can and cannot safely do. And we just advise the volunteers along the way to adhere to those guidelines and those safety procedures. And we ask our blind individuals that rely on our volunteers to do this the same thing, to practice social distancing, be safe, sanitize, wash your hands, and wear a mask when you are able to medically. We are still matching volunteers. Volunteers are out there doing things for people and with people. We do ask that when possible, people do it over the phone or virtually, but when that's not possible, to just adhere to those guidelines.
Hi, Sassy, it's Kate again. It looks like I have one last question from someone who asked, is it helpful for caregivers to be there during technology trainings or other trainings?
Ask the person who is blind in your family who's going through the training whether they want the person there, the caregiver there. It can be very helpful. Oftentimes, for example, I had an occupational therapist once go into a home and put markings on the stove and set up the person to start doing their own cooking. But then the caregiver came in home and thought that the person had accidentally splashed paint or something on the stove, and so scrubbed the marks off. So we had to come back in and redo it and meet with the caregiver and say, actually, this person can cook safely. Here's how that works, and watch them do it before they were convinced that the blind person could safely do it. So that fear kind of took over, and they said, well, the blind person can't possibly cook. And so they needed to be there to assure themselves that that experience could safely happen. That's just one example that's closely related to tech because it's a kitchen appliance. But for tech lessons, we recommend that the blind person let the caregivers know what's going on, what they're studying, what they're learning. They don't necessarily have to be there for the intricacies of how that works unless they want to practice with the person. outside of classroom time. But we do recommend that they keep up to step with what the person is learning about, what they're experiencing, whether that's in tech, whether that's in the support groups, whether that's in the volunteer experience, whether that's in peer support counseling, whatever the person is going through. We do ask, that if comfortable and if the family dynamics allow, that we share what's going on. And if the blind person feels comfortable having you involved in the discussion with the tech instructor and participating in class, we encourage it. There are places where that's appropriate and places where it's not. So the blind person gets to make that determination, but it can be very helpful, especially so that you don't inadvertently or unintentionally undo something that they're working on. We've often had kids who pick up grandpa's iPad and hear that it's talking and figure out how to turn the talking off. And then grandpa goes to pick up his iPad later to read the mail and can't get it to work. It won't talk anymore. And now he doesn't know how to get back in and turn the voice back on. So we ask that the family be aware that there may be tech things that are happening that don't necessarily make sense on the surface to a sighted person, but that make absolute sense to us. So again, use those phrases, take time and ask. And that will allow you to not inadvertently turn off grandpa's screen reader on his iPad, or take the taps off of dad's remote that he was using for tactile guidance, or move the lamp that grandma was using to read her books. Those little tiny things are what we come in and do, and sometimes family can inadvertently undo them. So we do ask that you guys keep in step with what the blind person is working on.
Thanks so much, Sassy. It looks like that sparked one more question here. We have
Yay!
What
I like questions.
we have what technological device is the most helpful?
Ooh. That's a really good question. That depends on the task. When the devices came out, such as iPhone and iPad, they made a splash for the sighted community, but they also made a huge splash for the blind community. My iPhone can do everything from reading my mail, as I discussed, to allowing me to download and read books. I could take a whole college course just using my iPhone and nothing else. It allows me to go online, purchase my groceries, pay my bills, do my banking, go online to social media, pay for things at the grocery store without having to look down at those obnoxious little purchase point of sale machines, which are totally visual. I can just tap my Apple Watch on the Apple Pay and go, and I don't need to have a sighted person read a screen to me. Technology has been the game changer for how blind people access the world since 1995 or so, when things really kicked into high gear. Whether it be for somebody who has been blind for a long time, a braille display that refreshes, just like your monitor, your screen displays text, a braille display works the same way. Whether it be an iPhone, an iPad, a computer that talks, or a magnifier that magnifies text. All of these things are game changing, and it really depends on the person's level of eyesight, and it really depends on the task that the person is trying to accomplish. There are some people for whom an iPhone would not work well because they're not that technologically savvy, or they don't want to be that technologically savvy. And so for them, there are other phone devices that talk that we can use. There are some people who just want to write a Word document and just want the screen magnified enough so they can see it. There are some people who want to be able to code and write their own website, and they can do that. So it really depends on the person and what they want to do. But in general, I would say a good 80% of what we train on is iDevices, Apple's iPhone, Apple's iPad, Apple Watch, iPod, things like that, that are the touch screen and have both magnification capability and screen reading technology built in, and it doesn't cost any additional money. The other thing that we see that is very popular right now is virtual assistants like Siri, like Alexa from Amazon. My Amazon device is probably about to go off because I just said her name. Nope, she's going to be good. Okay. Those are very good devices as well, because you can just talk. You don't have to have, as long as you know the vocal commands to give the device, it will respond to you. It doesn't require any memorized keyboard commands or memorized gestures. So we see a lot of virtual assistants becoming very popular, especially in the older community. But they require setup and they require maintenance sometimes if they get disconnected from the Wi-Fi network, or they experience an outage or something goes wrong. So oftentimes we'll, have to train the caregiver to support that if the person doesn't know a lot about their own Wi-Fi situation or things like that. So there's a good example of where caregivers do get involved in tech, is maintaining those virtual assistants in home. We see that a lot.
Thank you so much, Sassy. And thank you everyone for all of your great questions. With just a few minutes left here before we wrap up today, I'd like to take this opportunity to introduce our Commissioner, David Darkangelo, to say a few words. Commissioner?
Arlene, thank you again for you and your team for pulling this together. This has been a great week for caregiver support. I appreciate you and all your efforts. Thank you, Sassy. Great to hear from you. Our great
Hi,
partners.
Commissioner.
How are you? Great to see you.
Excellent.
And all of our partners over at MABVI. We work closely together, and it's great to have your support here. But to everybody else who joined, thank you for what you do as caregivers to support our community, our consumers. It takes a village. We've been saying that. I've been saying that all week. And it really is credit to you during these challenging times that we've been able to keep our people safe and healthy and continue our mission and services, programs and services going forward. So I just wanted to be sure. I'm sorry I was late. I was going to give you welcoming remarks at the beginning, but I was getting off another Zoom. So it's great
Save
to be
the
with
best
you.
for last.
It's great to be with you. Thanks again for all you do. And call us if we can be a resource for you. That's what MCB is here for. So thank you again.
Thank you so much, Commissioner. And thank you all again for joining us today. And we hope that we'll see some of you again tomorrow. And again, thank you, Sassy, for such a wonderful presentation. I hope you and everyone has a great afternoon.
Yep. If you need to find us, check out MABVI.org or give us a call at 1-888-613-2777, or you can reach us through MCB. They know where to find us.
Thank you, everybody. Have a great day. And
Bye.
we hope you can join us again tomorrow if you're able, from noon to 1 p.m. And all event information is available at mass.gov/MCB. And we hope you will join us again. Thank you very much, Sassy. Thank you to our caregiver community. Enjoy the sunshine. Bye.
Bye.